live. Okay. Hello, everyone. I'm thinking you can hear us. I'm just double checking. Yep, okay. Well, welcome everyone to our second Facebook live stream for 2026, where we've been going through talking to the speakers who will be coming to Winnipeg, Manitoba this May for the Reflexology Associations of Canada's 50th anniversary conference. Yay! I'm so excited today to be speaking with the amazing, the talented Barbara Scott today. For those of you watching us live on Facebook, please feel free to put your comments in the chat. We'll try and get to questions kind of at the end. If you're watching this later on YouTube, also feel free to add, comments and questions. We'll try to go back to the YouTube video and answer questions as they come. We'll give more information about some of the training later, but all the information about the conference can be found on reflexologyconference.com. And yeah, that's all me for housekeeping. So without further ado, love to introduce Barbara Scott. I can't believe it, Barbara. The first time we did this live stream was 6 years ago when you were planning to come to Canada for our 2020 conference, and then the world shut down.
That's amazing. I can't believe that.
Don't know where 6 years went, but
No.
For those of you who do not know Barbara, she is the chair of the Association of Reproductive Reflexologists. She's the founder of Seren Natural Fertility, and she has authored a book called Reflexology for Fertility. So she is quite the reflexology expert as it comes to fertility, reproductive health, conceiving, etc. So we're going to get into all of those topics. So please feel free, again, ask your questions in the chat. But I wanted to start, I guess, there, Barbara, because you've really carved out a niche as one of the leading voices in using reflexology for reproductive health and conceiving. So my first question to you is, what drew you to that topic? Like, how did you start, researching, getting into it? Like, how did you get into reproductive reflexology?
Firstly, thank you for having me, and I'm so excited to be coming to Canada and to be with you. And I know that you've got the most amazing venue. I think, is it the Museum for Human Rights?
It is. So we're
amazing. It's a special place.
Beautiful building.
Yeah. So thank you. So I have been there.
Okay.
I can't remember when it was. I have a feeling it was 2018, so quite a long while ago. But I'm so excited to be coming back and to be given the opportunity to speak at the conference. So thank you for inviting me. So how did I come to be doing this? It found me. I did not find it.
Okay.
So I did my training 30 plus years ago. Been involved with reflexology since my youngest son was a baby, and he's now 37. So I've been involved in reflexology for a very long time. But I went and did my training with Nicola Hall of the Bailey School, which was set up by Doreen Bailey in the UK. And we just did diplomas then. We didn't have CPD courses. We just did your diploma and off you went. And my very first client was someone with repeat miscarriage and fertility difficulties. What was happening for her was that she was getting pregnant. It was sometimes taking her quite some while to get pregnant, and then she kept early miscarrying. And of course, at the time, there was nothing there in reflexology terms that was going to help me to help her. All I knew about was just kind of literally balancing the endocrine system, and no other concept of really what to do for her and with her. So really it found me. And what it did to start with was it probably led me on a journey of about 15 years where I realised I was on my own. There were no additional support where I was going to gain information. So I realised I had to do my own research. And the fantastic thing about these groups of clients, patients, participants, whatever you want to call them, is that they go and have lots of testing. So the first thing I did was I was able to determine that actually what I thought I could feel in the reflex points, and to start with it was just women, was being confirmed by medical tests. So you might think, actually, I think there's a dominant follicle in that right ovary. And then they would go and have a scan to check what was happening in their cycle. And they'd say, oh, the right ovary has got a dominant follicle. And you think, oh, okay, that's really interesting. So that's confirming that. And then you might have, you might then think, well, I'm palpating these reflex points. And I think I'm going to talk about ovaries to start with because it's the easiest place to start. But that feels to me as everything is very quiet. I'm sure there should be activity and there's not very much happening. And then they might go and have some blood tests, and those blood tests confirm that maybe they have low ovarian reserve, or they have another underlying reproductive health condition which is impacting upon their ability to ovulate, and that's why you're not feeling what you should be feeling in the ovary reflex points. So at that point I was completely gripped because what I discovered was actually we could use science and therefore medicine to determine whether what we were feeling was the right thing in the reflex points. So I then found it really interesting. And then the next thing I did was I started to borrow some ideas from acupuncturists, because acupuncture, reflexology, similar modalities, they work in a very similar way. And I thought, well, if they are able to manipulate energy, why can't we do that? We must be able to do something very similar. So I kind of borrowed some techniques and applied them to reflexology and tried them on my clients, my patients, and then found that actually it was creating change. And not only was it creating change, but we could evidence-base that change. So we could either evidence-base it by seeing changes in basal body temperature charting, menstrual cycles, or we could see it in terms of changes in test results, or we could see it in terms of other medical interventions, testing that clients were having. So I thought it was, I always say I've got a very low boredom threshold. And I thought, actually this is really interesting. And even now I find it just as exciting. When I'm working with clients and, maybe they're going through IVF and we're assessing them. And you think, actually, that right ovary has got far more follicles in it than the left. The volume is greater. I can feel more little tiny bumps sitting in there, which are the follicles. And then they'll go and have a scan that afternoon or the next day, and it will say, right ovary has got, 12 follicles, and the left ovary has only got 5 or whatever. So you can then evidence base what you're doing, and I find it completely gripping even now.
So when you started, maybe could you give us some insights? How receptive were physicians or the technicians doing the scans receptive to your clients working with a reflexologist therapist? Like, was there backlash, or were physicians really open to if reflexology can help balance things so that the IVS takes better, or whatever the issue is?
So I would say in the early days, completely not receptive at all. And so, I would say this when I'm teaching. So if a clinician, if a gynecologist, if a urologist, whatever, says to a client, I don't want you to have reflexology, I don't like it, I don't want you to have it, and the client agrees with that, we have to step back even now. However, what I will say in clinical practice, it's only ever happened to me once, and the client said, I'm not giving up my reflexology, and the gynecologist said, okay, fair enough, carry on. But what I would say is, so I would say the dialogue has changed. So I've been going to medical conferences probably since about, I don't know, 2007.
Okay.
And now I have the absolute privilege of, in very relaxed circumstances, because I get taken with a group of gynecologists, scientists, urologists, whatever. In very relaxed circumstances, I'm able to have those dialogues with them. And so, I say I'm chair of the Association of Reproductive Reflexologists. Now, some will go, oh, that's really fascinating. I had that when I was a child. My mother used to take me, and then you have a very open conversation. And others go, oh, I don't really know much about that. And my opening comment is always, I cannot explain to you how it works. And actually, that immediately opens a different dialogue, because one of the things when you're talking with medics that have done 10, 12, 15 years of training, when we start off, we've usually, my diploma took me 2 years, probably because I was being a bit slow, but you can do a diploma in 12 months, and we have to be very mindful of the fact that medics will quite rightly get upset if we feel that we can influence things in a way that they feel it may be more of a challenge, because they're complicated and they have much, much more medical knowledge than us. So I think that's the first thing to be aware of when we're talking with medics. And I think if you go in with that premise, then they tend to become much more open. And so I've had the privilege of really, in probably the last 8 years, of having those conversations at medical conferences, and and things have progressed enormously. So I'll just give you 2 examples of how those things have changed. So I literally have just come back from the British Fertility Society conference in Edinburgh, and you will still find that there are lots of medics who just don't want to talk to you. They're very suspicious. It's not their mindset there, and that is absolutely fine. But you also get others who understand it, and if you talk their language, if you talk in a very science-based, evidence-based way, then they are much more open. And so for the last probably, 3 or 4 years, we have this amazing Professor Jonathan Ramsey. He's a very eminent urologist that works with male fertility. And when he opens there's usually a big dinner one evening. So when he opens, he talks about working collaboratively to this huge, there's 100 medics in the room, scientists, medics in the room, and he talks about working collaboratively, and he will say, we need to include reflexologists and nutrition and urology and gynecology and science, and those things need to work together. So I think there is a shift. It is changing, and I do see that, but we've still got a long way to go.
Of course.
A long way to go. So yeah.
I really liked what you said about and so you mentioned going to these conferences, speaking with medical professionals and saying you don't know how it works, but clearly you've emphasized the importance of evidence-based. The test results are showing that it's working. They're either showing the shift or they're right? So I think that strengthens the argument, or strengthens the dialogue to have with medical professionals, is that the test results clearly show if that there's a shift, or if this is happening, or
Yeah, and we need that because even if you have a client that gets pregnant, that could be very easily dismissed by, well, it's going to happen anyway, or there may have been some other underlying medical intervention that will have influenced that. And so, if we are able to say, this client came in with these parameters, and they were clearly outside of reference range. That doesn't matter whether it's male or female. Doesn't matter whether it's a semen analysis or sperm DNA fragmentation test, or it is a woman with hormonal profiling, which is not as it should be. If you can do that, and then you are working with that client, and then those tests are repeated, and you can see the difference. Or if you have a female client and we've got them charting, and we either use basal body temperature charting, or we use a piece of medical kit called ObviSense. And it's like watching reflexology in action. I mean, you actually can see and monitor the changes taking place throughout their cycle. And actually, if you are able to demonstrate that, then it's much more difficult to dismiss the pregnancy as a fluke, because what you've been doing is evidence-basing throughout the time that you've been working with them. So, makes it interesting.
And this is what you're doing your PhD in. I wanted to let everyone who's watching that you're currently studying your PhD, and you've been doing research, so you've been tracking all of these test results and the impact reflexology has had on.
So what we've done with that, so that is a very complicated thing to do, and it's very, very difficult. So I'll talk about research, and,
Sure.
and kind of what I've tried to do is find a way of determining the impact that reflexology is having in not in terms of taking, because not in terms of blood test results and taking semen analysis, because with that you would have to have a single centre environment to work within, right, which would limit your numbers, or multi-centre, multi-country, hugely costly. We would never manage to get that done, and we need something that's accessible. So how I've structured it is this. I want to look at what's happening, not just physiologically, but holistically. So we know that difficulties conceiving and reproductive health issues have a psychosocial impact. They impact upon how we function every single day, our relationships with others, what happens to us at work, etc. So, and we know that reflexology is very good at influencing those things in a very positive way. So, the research which I launched last week, we've got our ethical approval through just before Christmas, and so it was launched last week. So basically what we are doing is we are using an industry accepted online questionnaire called Fertiqual, Fertility Quality of Life Questionnaire. And basically it's a series of multi-choice questions which assess not just physical symptoms but psychosocial symptoms. So the premise is that on the first treatment or before they start treatment, reflexology treatment, they complete the online questionnaire. And then what we do is they have 6 treatments and then we repeat it. Mm-hmm. So we've got a before and an after. That's a really good way of determining the impact that reflexology may be having for them in a very holistic way. And the other thing, so that means we've got a body of data. So our power calculation, which basically means how many pieces of data we need for this to determine the hypothesis that we have put together for the piece of research, is 186. So we need to have 186 participants in that part of the research. Now, we did a data collection in 2013, and we had just 12 of our practitioners participating. We had 183 participants in that.
Wow.
Okay, so what we now have, we've got a closed Facebook group which has got about just over 300 practitioners in it. So we are hoping that even if all of them just submitted one participant, we would have met that. So I'm on it at the moment. I'm saying, please join in, please join in. And the thing I want to say here is, actually, we have ethical approval for the UK, Canada, and Australia, and we do have practitioners, active practitioners in Canada, and we really do want them to participate in the research. It is open to them as well as practitioners. So that's the first part. Let's get a body of data. If we get that many as a number, it's going to probably be one of the largest pieces of research that has been undertaken using reflexology, just from a data point of view. And then the other thing that is very current in medicine is hearing the patient voice. So if you look at medical practice and maybe developing a new drug, you can develop a drug that may show efficacy in a certain area, but unless you have patient engagement in that, it's not going to fulfill its role. So there is a lot more research out there now in terms of how do you feel as a patient taking this? What would make you take it? What would make you not take it? What benefits do you see? And so the patient voice, and in this particular view, it would be what would be termed as a qualitative study. So you are hearing the personal view of that person. So it will be interview based. So I will basically record interviews with probably up to 12 participants to hear their personal experience of, why they chose reflexology, what they perceived the benefits to be, what they perceived any pitfalls in terms of having treatment difficulties that they've experienced, and then we start to draw out of that what are called emerging themes. Mm-hmm. So are there commonalities in that? So that will be the second part of the research. So hopefully it'll be really robust and comprehensive, and it'll be a way of encouraging others to come and do more research in that field, because that's the thing that we need. This is just a start.
Absolutely. We always need one person to kind of set off the, catalyst for research. And just thinking back, a few years ago, not even a few years ago, let's say 20 years ago, someone did that first research on like reflexology's impact with people going through cancer, and now look at like so many other researchers jumped on that. So it's amazing that you are starting that initial, get the good groundwork to hopefully launch other researchers and to get interested.
Yeah. And I think also, I know that the health system is quite different in Canada, but over here in the UK, most reflexology is privately funded. You would view it as private healthcare. Yeah. And, my view is, and actually this conversation came up at the conference in terms of medicine as well, is that actually there are lots of people who would like to use this as a modality to support them on their journey, whether it's reproductive health or fertility, and they can't, because they can't afford to fund it themselves. So one of the reasons I really need it to be very robust is so that we can use it to start influencing stakeholders, maybe influencing social prescribing, so that it becomes more widely available to those who would like to use it.
So, absolutely. No, same thing here in Canada. Most of what we would, deem integrative health, reflexology, massage, acupuncture, it's privately funded. It's not publicly available, and cost is always a factor. I want to bring it back. So you mentioned, the participating in this research is open to Canadian reflexology therapists who, of course, are properly trained. So I kind of want to pivot to your training. So you've developed specific protocols for working with both men and women on a variety of reproductive health issues. Can you talk a little bit more about why, in your opinion, you feel it's important to have specialized training when working with this specific client group?
Yes, and someone else asked me this question, and And one of the things I will say is this very specific group of patients, clients, will be hugely knowledgeable. Most of them have, by the time they get to see us, they already have been on a very long journey. And they will have done a lot of their own research. Now, the difficulty with that is they will have done research and think that it applies to them, and sadly it doesn't always. It's very difficult to be objective, yourself. It's incredibly difficult to be objective about your own circumstances. So they deserve for us to be more knowledgeable than they are, so that we can ensure that we signpost them for the correct testing if there are things that have been missed. That we understand what they are undertaking. So, if they're trying to conceive naturally, we really need to have a good understanding, a very robust understanding, not just of the menstrual cycle, but of reproductive health issues that may influence how they are functioning from a reproductive health fertility point of view. And that applies to both men and women. So, for example, one of the lectures I attended when I was at the conference was on treating varicoceles in men. So what we know, varicoceles, little varicose veins in the testes, that influence sperm quality. Now, one of the challenges is that most general practitioners, doctors, don't understand that. So for men to access that, it can be quite challenging, and there are different means of treating varicoceles for different scenarios. And so, what we may find is that there are two ways: surgical, or what's called embolization, where they introduce like little metal coils to improve blood flow. Now, the fascinating thing about that is you can see in the reflex points in men whether they have a varicocele. Okay, so basically when you look at the testes, reflex point quite often have little blue veins crossing across the testes reflex point, and you would then ask that question: have you self-examined? Are there little blue veins in the testes, in the scrotum, and send them away? Now, we need to have that knowledge so that, I'm just using it as an example, so that we can then make sure that we empower our male patients to go back to see their general doctor to say, actually, this is a problem. Please, can you refer me on to a urologist because it needs further intervention? And I think we need to have really comprehensive knowledge and understanding of reproductive health and fertility and any forms of assisted conception, so that we are able to support our clients in the best way possible. And if we don't have it, we can't do that. These are really complicated cases at times, and they come to us seeking answers and support and help. And it isn't, managing stress is hugely significant and important, but we also need to be very knowledgeable about what to do and when, particularly when we're supporting drug protocols. What is that drug trying to achieve? How can we support it in so that it works at its optimum? So I don't know, it's quite a long answer to a short question, I think, Laura.
You're giving us so much great information, and I love what you said about being knowledgeable. Personally, I love learning new things, so I can never learn enough. And then your emphasis on, for the reflexology therapist to be able to support your client through this journey, you really need to know all of the options that are out there, what their other doctors or clinicians are talking to them about, how that can impact their body, and then how the reflexology could affect or impact that or respond to that. So it all works together. I think.
Oh, it does.
Right?
Absolutely. I always describe this as a patient-centered integrative approach, I think.
Yeah.
Because reflexology is just part of the process for them. You've got your patient in the center, and reflexology is one thing, but they may go and have further testing, they may go and have some nutrition, they may have some acupuncture, they may take some supplements, they may go and, have some further interventions like varicocele embolization, and all of those things are about supporting that individual, and it makes sure that they get everything that they need. So we kind of need to understand all of those processes and the things that are available to them, so we can make sure they get that, really.
No, I love it. So you've developed this, a variety of trainings to help support different clients depending on what they're going through or seeking. And you're going to be coming to Winnipeg. You'll be giving us at the conference during your seminar sort of an overview of kind of where reproductive health reflexology fits in to that.
Yeah.
But you're also going to be doing a 2-day pre-conference workshop on reflexology with menopause.
Yes,
and
absolutely.
Expanding that. And I want to talk about that because menopause, perimenopause has kind of become like a hot topic right now.
Yeah.
Through the zeitgeist social media. I guess my generation has become very aware of like this is the change that we're entering into, how it could affect us mentally, physically, emotionally. So how do you see, the shift impacting women's healthcare right now? Like, what are you seeing the shift in more women, openly talking about it, openly trying to, seeking to understand it? And like, where do you see reflexology fitting into that shift?
Yeah, so I think the first thing is that there is a dialogue now. It used to be not spoken about. Women would never discuss the fact that they were going through their menopause. And when I say menopause, I use it as an umbrella term, which is perimenopause, menopause through to postmenopause. And there are different aspects to each of those parts of going through menopause, with their own challenges. And I think the important thing is that we are now openly speaking about it. And actually, very interestingly, I was in New Zealand in the autumn last year, and I was teaching a menopause course in Christchurch, South Island. And one of the women there, her husband was an engineer, and he worked in a company. And I think it was the HR manager, I may be entirely wrong about this, but the HR manager was finding that his wife was really experiencing challenges going through menopause, and in a very enlightened way he brought someone in to the company to speak about the challenges that women face going through the menopause. That is so important because it influences what happens in the workplace and our understanding, and that then motivates a drive and a need for more research for women who are going through menopause. We've been sadly, discarded. And actually, when we're going through our menopause years, is when we have our most wisdom. And if we support women, I'm just going to talk about the workplace as an example. Sure. But if we support women in the workplace when they are going through their menopause, we are not going to lose them, and all of the skills that they have developed over, maybe 40 years of working. The skills and the wisdom and the knowledge they have, we want to maintain that. So we need to have, and we are starting to see this happening, we need to have workplace policies for women who are going through menopause. And that is starting to happen, and that is a real joy to see. I think that's the first thing, is that, and we are seeing more research starting to be undertaken. But when it comes to working with menopausal women, what we have to remember, and certainly the way that I teach and the protocols that I use, focuses on women who have, been through medically induced menopause, or menopause that may be temporary because of medical interventions, it may be surgical, but also, and this is really important, is women who are experiencing premature ovarian insufficiency. So they may be menopausing earlier. Okay. And what we need to be aware of with those women is that they will be seeking, if they haven't completed or started their family, they will also be seeking to find ways of preserving their fertility. So we need to be aware because of that, because we've got increasing numbers of women who are menopausing earlier. And we've also got increasing numbers of women who are delaying having their families because, they're better educated, they're going through university, they're climbing career ladder. So actually having a family is delayed. And then they find they're in early menopause, and we need to work with them in a very different way when we are working menopausally. So it is really important to support women who are going through menopause, but we also need to make sure we include those groups of women as well, and the challenges that they may face. And one of the things I start the teaching with is that the symptoms we associate with menopause are actually usually perimenopausal symptoms. They are the ones that we think about every day. They impact upon us, they influence us every single day. They feel horrible. Mm-hmm. But they are not necessarily life-limiting. They may impact upon our everyday life, but they don't necessarily limit our life. Once women go into post-menopause, they are more likely to have silent symptoms that are much more likely to be life-limiting because they have lost all of the positive benefits of estradiol, our E2 form of estrogen, which provides protection against certain cancers and cardiovascular disease, etc., and including how our urinary health is, because that has a huge impact, and a lot of people don't recognise that. But that is much more likely to impact upon how long we're likely to live as women, but we might not experience daily symptoms of it. So I always say, the older we get, the more of a privilege it is, but the better care we need to take of ourselves, really. And so we kind of do discuss that as we go through the course. It's really important to understand how important that is.
So in your experience and opinion, do you feel that with this growth of understanding of the impacts perimenopause, menopause, postmenopause play, and some of the other things that could happen to women, do you feel that reflexology can play a bigger role in supporting women going through these stages? Or is there, in your opinion, is there a way for reflexology to kind of like be one of the stop gaps, or one of the things to be like, add this to your health and well-being routine as you progress through these stages?
Yes, because so if I kind of go backwards, so one of the benefits of me not coming to Canada in 2020 was that, we went into lockdown and we started having discussions about what we could do to support our practitioners, who are members of the association, whilst we were in that lockdown. And one of the things that we knew as practitioners, that the techniques we were using in reproductive health were actually beneficial to menopausal women. And so I was persuaded to put together a short kind of free to access course it literally was just a couple of hours. These are the things you need to think about for our practitioners, and we provided that to them during the first lockdown when we couldn't go anywhere or do anything. And then what happened was I was thinking, actually, this is just the tip of the iceberg. There needs to be more information here, and we need to kind of expand what we're doing, and we need to expand our understanding. So it grew and developed from there. So we knew that the techniques already, as an evidence base, were influencing menstrual cycles. And what we then knew was that they were going to support women as they went through their menopause. Now, you don't want women to stop menopausing. It is a natural part of the aging process. But what we do want to do is ensure that women go through with the least symptoms as possible. And so actually using the techniques, what we find, certainly as women are going into perimenopause and they're experiencing those kind of daily symptoms, that if you can steady the decline, so the decline comes about because ovarian reserve is declining and the quality of the eggs is declining. And so if you can steady that process, So it isn't a sort of drop off a cliff and then it surges again. We want to stop that. What we want to do is just gently steady that. It improves overall symptoms. And so, and you can evidence base it in the same way. You can use medical tests to evidence base it in the same way. I don't get time to teach all of that on the menopause course, but what we know is that you can do that. And so that then means that reflexology does have a very significant role in stabilising symptoms. And the other thing just to be aware of is there are a lot of women for whom taking HRT, which is still held as gold standard, it's not suitable for everybody. Mm-hmm. And we do, so when I'm teaching, I use some medical flow charts, which helps to helps medics to determine treatment pathways, but actually it's really good for us to understand it, because what you can see from that is that it actually is not suitable for all women to have HRT. It doesn't work for some women. Some women don't like the side effects, and for some women their risk factors are too high to take HRT, and therefore you can use reflexology as a modality to support as they go through.
I feel like there's just such a huge potential with reflexology and this population, especially as it's so, like you said, the dialogue we're talking about it in the workplace, we're talking about it, in social media. There's just a huge opportunity. So I will plug your pre-conference workshop. There's actually only 6 more spots available. I checked right before we came online because we capped it off at 20. I just checked, so we only have 6 more spots available. It's May 21st and 22nd here in Winnipeg at the Canadian Museum for Human Rights. Go to reflexologyconference.com if you want tickets, because I think we all could benefit a lot from Barbara's experience and expertise in this area. And just also,
gosh, that's amazing. Yeah. I'm a bit blown away. That's quite extraordinary.
No.
How wonderful.
Well, as I mentioned, I think it's just we're talking about it. Everyone's really aware of it. So then, how do we support more than 50% of the population as
exactly?
Right?
And we have an aging population. We honestly, it's very important, because one of there are some studies that I use when I'm training. And we look at the impact upon the workplace, and of course, what happens is we get more aches and pains. And if you've got someone doing a very physical job, it impacts upon their ability to work effectively. Mm-hmm. And so, if we can use reflexology to support them and keep them in work, that's going to have a huge amount of benefits, because it impacts upon their not just their ability to work and earn a living, so financial aspects, but also socially, culturally, from a mental health point of view, emotional well-being, all of those things. So actually I think reflexology has an enormous role to play in supporting keeping women in the workplace. And one of the things that's really important about that in the bigger picture, so one of the things that we were talking about at the Fertility Conference was that, of course, we have a falling birth rate.
Yeah.
And we very basically don't have enough working population to support our pension age population. So the longer we can keep women working in good health, the more it is going to support to support what's happening in terms of social structure, etc. So it's really important.
No, that's a great point. And it's always good, like, these things don't happen in a vacuum. And one of the things, Barbara, I really appreciate of the way you teach is looking at we're not just learning a protocol, we're not just learning, what, stimulating this specific reflex point might do on the client, is looking at their emotional, their mental, their physical well-being, and looking, I know the buzzword here in Canada is whole person care, but looking at, that's the buzzword. But I really appreciate your teaching to that, looking at someone as a whole person, like they're not just coming for one issue, but this one issue is impacted by all these other factors.
Yeah. Do you know there was I saw this a few years ago. There was a man speaking on the national BBC News, and basically his wife was going through the menopause, and her mental health had suffered to such a degree that he didn't know that she had kept it to herself, and very sadly she took her own life. And so he was speaking very publicly and saying, I didn't know that. I didn't understand anything about the menopause. I didn't understand the symptoms she was experiencing. And I wish I had, and I want to make sure that everybody else knows about it. And I think that is why the dialogue needs to change and is changing, because we need to understand when it is appropriate for women who are going through menopause, because we know that it has a horrible mental and emotional impact on us as we're going. I mean, some women, it is like teenage years in reverse, but it's heightened because we have huge responsibilities at that point in our lives as well. So yeah, really important. It's really important to understand that.
I hope whoever's listening was encouraged by that if this is the client area that you're wanting to specialize in, or if you are on the fence about taking additional training to support clients either through their fertility journeys but through menopause, that this is the type of impact that could have. I never want anyone to suffer in silence, so you can play a role in supporting someone through that.
Absolutely. And one of the other things we know about our treatment sessions is that they get to talk. We get to listen. And it may just be that they just need to speak. I know there is this, we like them to kind of rest and relax and go off and have a life. I always say it's very meditative, but you quite often will find that certainly with my own clients, that in this particular field, they will talk all the way through. And I see that as part of the therapeutic process. Mm-hmm. It is a time when they can just say whatever feels, however things feel for them. And actually, I think that's part of the process for them. Yeah.
Thanks.
So it's useful.
All right. Well, we have just a few more minutes left, so I'm going to just check to see if anyone has any questions or comments. I see one question. Do I see a question? I'm going to refresh. If anyone does, please feel free to put it in the comment section under the live. I guess then my last question to you, Barbara, is kind of just what are you looking forward to for coming to Canada? Like, it's been almost 10 years since you were last here. Anything you're looking forward to, or things you want to experience or say to our therapists here?
Well, I'm just looking forward to coming and meeting all the Canadian practitioners. I think it's going to be a wonderful conference. You've got amazing speakers. I'm really looking forward to listening to them as well. And I just think if we come together as a community and share and interact with each other, we all learn from each other. I think you've got an amazing venue. I've already said that. And as I say, I've been to Winnipeg before, and it's really beautiful. So I am very much looking forward to that aspect of it. But I'm just looking forward to coming and being with everyone. I think conferences are a fantastic way of sharing information, and I think it always is better in person. I do lots of online stuff, but as I said, I've just come back from this conference in Edinburgh, and you have conversations that you would never have online. Yeah. It is always better to be there in person. So I'm looking forward to coming and meeting you all in person and being with you and experiencing the whole conference experience. So it's been lovely.
Well, I am very excited to finally get to meet you in person. We've been chatting and speaking and emailing each other for over 6 years, and so it'll be great to finally be in the same physical space. I will tell everyone watching, we understand Canada's a huge country. We're really big. So not everyone can physically travel to Winnipeg. So there is a virtual component of the conference. So if you're not able to travel, you can get connected and through the live streams and still chat with online participants and ask questions. So if that's not able to necessarily travel to Winnipeg, you can still join us. Go to reflexologyconference.com for all the information. Barbara's going to be speaking on Sunday, May 24th, doing a seminar about her research and putting reflexology in perspective in the context of reproductive health and the research she's doing, as well as doing a 2-day pre-conference workshop on reflexology and menopause, which, as I mentioned earlier, only has 6 tickets left as of January 14th, 2026. So if you want to get access to that training, go and register now. I'm checking one more time if there's any comments, but if there's not, don't see any. I just want to thank you, Barbara, for taking the time out of, I know you have a very full teaching schedule as well as all of your other responsibilities and your research. So I really appreciate you taking the time to share just all of your insights about this. It's very specific, but I think it's good that you've narrowed in on this niche of reproductive health and fertility, and that you have managed to connect it to evidence-based so that it connects to tests, that we can actually see the impacts reflexology is having on medical tests. So thank you so much for all of your contribution to the reflexology field, and looking so forward to meeting you in person, hearing you present all of this in person.
Well, it's honestly, I feel privileged to be asked. I feel privileged to do the work that I do, and it is terribly exciting. And then to be able to share that with others is a real honour. So thank you for asking me. And I'm really looking forward to meeting you in person. It's going to be wonderful.
Well, thank you, everyone, and join us next week, same day, same time, as we speak to another one of our conference speakers. Have a great day.
Thanks.